Do you ever feel like there's a popping sensation in your knee, or that your knee is locked in place and you can't move it? These may be signs of a meniscus tear. So what can you do about it? Let's find out today on Around Phelps Health. Welcome to the show, everybody. I'm your host, Paul Hackbarth, and with me today is Dr. Sylvester Youlo, an orthopedic surgeon here at Phelps Health. Thanks for being with us today.
Thank you for having me.
Yeah, so we're so glad you could come on and talk about this topic. Are meniscus tears, are they a pretty common thing that you see in our orthopedics clinic?
Well, first of all, let me tell you a little bit about myself. As an orthopedic surgeon, I'm also a specialist in knee treatment. I treat knee ligaments and cartilage. I have a special training that I'm a fellowship trained sports medicine surgeon, and this topic happened to fall on the things I treat. It's a topic I'd like to talk about. But yes, we do see quite a bit of meniscus tears in my clinic. In fact, around the United States and around the world, meniscus surgery is the most common surgery that is performed.
Okay, that's really interesting. So first, I want to start off by asking, what is a meniscus exactly?
Well, what a meniscus, the way the knee, I have a model here I'd like to show you. Okay. And the way this is a knee model. This is the front of the knee, the back of the knee. This will be your thigh bone, and this will be your shin bone. And the thigh bone, as you can see, sits on top of the shin bone. The end of the bone is covered with a layer, which is called the cartilage. That layer needs to be protected. You don't want to lose that layer as best as you can. And the meniscus sits between the two bones. That thing there is what a meniscus will be. And the job of this meniscus is to serve as a shock absorber. So it protects the end of these bones when you walk. For sure. Okay, so it sounds like they're pretty important then. The meniscus is very important. You actually don't want to lose your meniscus if you can. There are situations where you can lose some of it, but you want to keep the meniscus as best as you can. Okay. I mentioned some of these symptoms at the top of the show. Can you give me a rundown? What are some symptoms that somebody has a meniscus tear? So the people have different symptoms, but most of it is pain. And some people will tell you, I feel that there is something that's stuck in my knee. Some people will tell you, I feel like something is stuck in my knee and I can't move it. And then I have some patients that my older patients would say, I have this aching, nagging pain. It's almost like a toothache. It's just there. It won't go away. So most of the time, at the end of the day, sometimes twisting or turning your knee and you have this kind of pain. Okay. So, yeah, I've heard that locking or catching of the knee is pretty common. Are some of these symptoms more common than others? That's right. Now, the locking is not as common as the catching. So you feel like there is something that is catching. When the knee locks and it doesn't want to move, that is severely painful. And sometimes I need something to be done right away. But the catching sensation and the locking, the dull, achy pain, they are very common. Okay, and can people who have a meniscus tear, can they still walk, or are there activities maybe they should avoid? So if you have a meniscus tear that is not locking the knee, you can walk on it. Okay. Having a meniscus tear doesn't prevent you from walking, except the pain may prevent you from walking. Now, one thing we haven't talked about in a minute is there are two kinds of meniscus tear. They are very important. So you have to know what the two differences are. There's what we call a traumatic meniscus tear and a degenerative meniscus tear. So a meniscus tear that happened in a kid that plays football is different than a meniscus tear that happened in a 40-year-old guy who was just walking down the street and twisted his knee. Those tears need to be managed differently. The urgency for treatment is different, and that is important. So a kid who plays football that has a meniscus tear needs to be treated differently compared to a 40-year-old guy who went to Walmart and twisted his knee. Okay. Well, I think that's a great segue into our next question. So you talked about the two different types of meniscus tears. How are they treated then? How would one with a sports injury compare to someone who had a more degenerative meniscus tear? So for sports-related meniscus tear, especially in young, healthy people that have normal cartilage, those most of the time needs to be repaired. Because you can repair it and you can, in most cases, have it heal. In a patient that had a degenerative meniscus, that older patient, the way to treat them most of the time is usually conservative. Medication, activity modifications, ice, rest, taking an NSAID, that might help you. Okay. People that have the mechanical symptoms, where you feel that something keeps catching and locking, in most cases, that there's a piece that is moving around, there's a piece that is moving, and usually that end up needing surgery for it to go away. But it doesn't always need surgery. It does not always need surgery. So meniscus tear does not always need surgery. Okay. So because your MRI scan said you had a meniscus tear does not mean you need surgery. Okay. It means you need treatment because you're having pain. And once we can get your pain better, even with the tear in there, if your pain is better, you don't need surgery. That is different That is completely different from a traumatic meniscal tear. This is a degenerative meniscal tear.
Okay, all righty. Well, thank you again so much for Dr. Youlo. I always learn a whole lot when I'm talking with you, so thank you so much for coming on and talking about this topic.
Thank you for having me. I appreciate it.
Before we go, I want to let our viewers and listeners know that if you're concerned about meniscus tears, if you're concerned about joint pain and that's keeping you from doing the activities that you love, make sure that you call our Phelps Health Orthopedics Clinic. That number is 573-364-5633. And remember, if you'd like to know more about the topics that we cover on this series, check out phelpshealth.org. We'll see you next time on Around Phelps Health.